Open your medicine cabinet right now. Look at the shelves. How many expensive bottles of glucosamine, chondroitin, or omega-3 joint supplements are sitting there? How many times a week do you swallow ibuprofen, naproxen, or acetaminophen just to get out of bed in the morning? Do you spend hundreds of dollars a month on these pills, yet your lower back still grinds, clicks, and locks up every single day? If you check these boxes, you are caught in a massive medical and financial trap. You are attempting to fix a severe mechanical failure in your spine by swallowing chemicals. Today, we are going to look at the clinical research, explain the exact microscopic anatomy of your spinal joints, and reveal why those expensive joint supplements are physically incapable of repairing your back pain. To understand why these pills fail, you must understand the microscopic anatomy of your spinal joints. The joints in the back of your spine, called facet joints, are covered in a smooth, frictionless layer of cartilage. This cartilage allows the bones of your spine to glide past each other seamlessly when you bend or twist. But human spinal cartilage has a very unique design flaw. It is completely avascular. This means there are zero blood vessels inside the cartilage itself. It does not have a blood supply. So how does the cartilage stay alive? It absorbs its nutrients incredibly slowly from the surrounding joint fluid, much like a hard, dry sponge absorbing moisture from the humid air. It relies on a process called imbibition. Every time you move your spine, the pressure changes inside the joint, which slowly pushes the lubricating fluid in and out of the cartilage tissue. This is a very delicate, highly isolated mechanical system. Now let us look at the journey of a joint supplement. When you swallow a glucosamine or chondroitin pill, it goes into your stomach. It gets heavily broken down by your powerful stomach acids. The surviving molecules enter your intestines, pass into your bloodstream, and circulate throughout your entire body. But remember the design flaw of the spine. Because your spinal cartilage has no direct blood supply, almost none of that expensive supplement ever reaches the damaged, grinding joint in your back. Swallowing a joint supplement and hoping it magically rebuilds your spinal cartilage is like pouring a bottle of premium engine oil directly onto the metal roof of your car and hoping it somehow makes its way inside the engine block. The delivery mechanism is fundamentally broken by the laws of human anatomy. The medical research on this is incredibly clear. Large-scale, peer-reviewed clinical trials have repeatedly shown that for spinal osteoarthritis, oral glucosamine and chondroitin provide almost zero measurable relief compared to a placebo. They are a harmless waste of money. But there is a much darker, hidden danger sitting right next to them in your medicine cabinet. That danger is non-steroidal anti-inflammatory drugs like ibuprofen or diclofenac. When your arthritic spinal joints lose their cartilage, they grind bone on bone. This creates a massive, localized fire of inflammation. Swallowing a non-steroidal anti-inflammatory drug pill temporarily suppresses the chemical signals of that fire. It blocks an enzyme in your body called cyclooxygenase. It acts as a chemical band-aid, but it comes with a terrifying cost. That exact same enzyme is responsible for protecting the delicate lining of your stomach and maintaining the blood flow to your kidneys. Taking these medications daily for chronic back pain forces your internal organs to process highly toxic compounds. Long-term use of non-steroidal anti-inflammatory drugs dramatically increases your risk of severe stomach ulcers, dangerous gastrointestinal bleeding, sudden spikes in blood pressure, and permanent kidney failure. You are slowly destroying your internal organs just to temporarily mask a mechanical problem in your spine. You cannot fix spinal osteoarthritis by guessing, and you cannot fix it with a pill. We must look inside the machine and identify the exact millimeter of the mechanical failure. This requires high-definition magnetic resonance imaging. When an elite neurosurgeon reviews an MRI for spinal arthritis, we are not just looking at the bones, we are hunting for the inflammation. We use specific T2-weighted MRI sequences, including fat suppression techniques, to look for a phenomenon called bone marrow edema. On the MRI screen, the solid dark bone of the spine will suddenly show a bright, glowing white signal right at the joint line. That glowing white light is the objective, undeniable proof of active arthritis. It tells us exactly which joint has lost its cartilage and is actively grinding bone on bone, creating the fire. We also look for modic changes, which indicate that the bone itself is starting to fracture and degenerate from the chronic stress. Finally, we evaluate the spinal canal. We must check if the inflamed, overgrown arthritic joint has expanded inward. If the joint grows too large, it will accidentally crush the delicate nerve roots that travel down your legs. A chemical pill cannot widen a collapsed tunnel, and it cannot shave away an overgrown bone. Once we map the exact location of the damage, your treatment becomes a clear choice between passive masking and active repair. Option A is the traditional conservative route. This involves continued painkiller dependency, generic physical therapy stretches that might actually irritate the joints further, and living with chronic restriction. This path guarantees that the joint will continue to degrade over time while your kidneys and stomach bear the toxic load of the medications. Option B is targeted mechanical intervention. If the MRI proves that your pain is strictly isolated to the arthritic facet joints, we bypass your stomach and your bloodstream entirely. Instead of swallowing a pill and hoping it reaches your back, we deliver the solution directly to the site of the fire. We use live X-ray guidance, called fluoroscopy, to inject a powerful, localized dose of anti-inflammatory medication precisely into the microscopic joint capsule. This puts the fire out immediately, directly at the source, without damaging your internal organs. For patients who want long-term freedom from daily pills, we utilize a highly advanced, minimally invasive protocol called radiofrequency ablation. If your spinal hinge is permanently damaged by arthritis, medical science cannot magically regrow the lost cartilage, but we can permanently turn off the broken alarm system. Using live X-ray guidance, we carefully advance a specialized microneedle directly to the medial branch nerve. This is the tiny, microscopic sensory wire that connects your grinding arthritic joint to your brain. Once the needle is perfectly positioned, we use highly controlled thermal energy to safely deactivate that specific nerve. It is a highly precise disruption of the pain circuit. The arthritic joint remains exactly where it is, and your spine remains completely stable, but the pain signal is permanently disconnected. The grinding stops hurting, you regain your mobility, and you can finally throw those daily painkillers in the trash. If the arthritis has grown so large that it is actively crushing a major spinal nerve and causing sciatica, we bypass the needles. We use advanced endoscopic tools through a tiny incision to gently shave away the overgrown bone, physically freeing the nerve and instantly curing the leg pain. Chronic spinal arthritis is a mechanical disease. It requires a mechanical solution. You cannot cure a grinding bone with a vitamin, and you should never risk your internal organs by relying on chronic pain medication to get through the day. You must identify the exact joint that is failing. Stop treating your back pain blindly. Let our expert neurosurgeons review your medical imaging. Click the link in the description to upload your MRI or CT scans to our secure portal. We will map your spinal anatomy, hunt for the glowing signs of inflammation, give you a definitive second opinion, and build a targeted, surgical, or minimally invasive plan to stop the pain at its source.